Gosh, I really don't know how to start one of these though. Do I like call my mom and ask her how I do one of these? Hey guys, today I just want to share with you guys a few things that What's up YouTube? My name is Jonathan. Welcome to my channel, and today I'm going to be talking to you guys about a few things that you should know before starting nursing school. I am a 4th year nursing student and I'm going to graduate in May, and I just wanted to be able to do this video to share with you guys a few things, tips, advice, my experiences, mistakes that I've made, and share them with you so that you could be able to form your own opinion and your own approach to the experience that you want to have in nursing school. I'm also going to post some workout videos on this channel because you already know we got to get these gains, but for the purpose of this video, I'm going to be telling you guys a few things that I wish somebody would have told me before I came into nursing school. So if you are a nursing student now, or if you're considering nursing school or you're about to start a nursing program, then this is the video for you. So the first thing on the list is that nursing requires time. Guys, nursing school, you are going to be really busy. You're going to be busy between your lectures, between going to your labs, your skills labs, between going to simulation, between going to clinicals, between doing your homework and studying for exams. Guys, there's a reason why nursing school is considered one of the toughest bachelor degrees to get. If it were easy, a lot more people would become nurses. A lot of people that really shouldn't be nurses, but you know what? That's okay, because not everyone is meant to be a nurse, and it is not of the faint of heart. But guys, it is so rewarding. I promise it all pays off in the end, but for now, you're gonna have to put in the time because nursing school requires your time. You're gonna have to put the time into studying. You're gonna have to put the time into doing homework. You're gonna have to really put the time into really learning and understanding the material that they're throwing at you, because in nursing school, they're going to throw a lot of information at you at a really quick pace. In lectures, you're going to be learning the background knowledge that's gonna set the foundation for your nursing practice. You're gonna learn anything from diseases, how diseases are caused, what risk factors are going to increase the risk that that person is going to get the disease, what medications are going to treat that disease. Then you're also going to have your labs where you're going to learn anything from basic nursing principles such as how to ambulate a patient, how to feed a patient, how to reposition a patient, all the way up to more advanced nursing skills such as inserting an IV, inserting a Foley catheter, inserting an NG tube. You guys are also going to have that clinical portion. Nursing school would not be nursing school without clinicals. That is where we do the majority of our learning. Yes, we're gonna be in the hospital taking care of real patients with real diseases. It's amazing to be able to come from lectures and integrating all of your information that you learned from your lectures, from your studying, from your labs, and actually seeing it occur in a real life patient. This is your time to show off what you've learned and how you are going to incorporate your own nursing practice to this patient. On top of that, you guys are gonna have homework to do. You guys are gonna be busy studying for exams. You might even be busy working to be able to make some extra cash. I mean, who doesn't like some extra cash? You guys are gonna learn really early on in nursing school that nursing school is gonna take a lot of time. Guys, between nursing school, your labs, your clinicals, your lectures, homework, studying for exams, and your other responsibilities outside of school, you guys are gonna have a really tightly packed schedule. Your mind is going to be in like 20,000 different places when you first start nursing school. And that leads me to my next topic. Nursing school requires you to be able to prioritize. Prioritization is key when you're in nursing school. Nursing school requires prioritization. One really beneficial piece of advice I can give you is that you guys need to get a calendar or a planner, okay? In this way, you guys can grab your syllabuses, you look at your course schedules, look at all your assignments and exams that are day by day, projects, papers, and you guys are gonna write them on your planners. You guys are gonna write them on your calendars. So that way you guys are gonna be able to manage your time more efficiently. Once you guys have everything written down in this thing, then guys, it makes prioritization a whole lot easier. You guys are gonna know when you're gonna be able to hang out with your friends. You guys are gonna know when you're gonna be able to have time to watch that Netflix series. You guys are gonna know when you could take a nap. This right here, this calendar right here is a lifesaver, okay? I promise you. Prioritization is key, okay? If you guys don't like a calendar, what I see a lot of other people doing, a lot of people would rather prefer a notebook style planner, and that's fine, whatever you prefer, as long as you could get it written down and you actually have a physical, visual copy of your schedule so you can be able to see it. Then you guys can more easily prioritize what needs to get done and what things that you can do on your free time. For example, if you guys have clinical, then you might not want to hang out with your friends the night before. If you guys have an exam one week, then maybe you want to study a little more and pick up less shifts at work so you can be able to focus on that exam and perform better on it. For now, when you're first starting off, nursing school is going to be really tough. You guys are going to need to put in the time to study. You guys are going to need to do well in your exams. You guys are going to need to pay attention and take really good notes in lecture. And you know what? That's going to lead us to our very next topic, the grading scale. Okay, this grading scale is unlike anything that you've ever seen, okay? With any other degree, a 90% is gonna get you an A, an 80% is gonna get you a B, a 70, a C, a 60, a D, and a 50, an F. Guys, for my nursing program in particular, which is very similar to other nursing programs and their grading scale, a 93 to 100 is considered an A, an 85 to a 92 is considered a B, a 77 to an 84 is considered a C, and a 70 to a 76 is considered a D. Anything below that is failing. But guys, for my nursing program, you cannot get anything below a 77. That is considered not passing, and you will have to retake that class. You guys should always strive to do your best in your classes. You should always try and study as hard as you can. You should always try and do the best that you can in exams, because guys, the more you apply yourselves now, the more stronger and more solidified of a nursing foundation you are going to have, and the better experiences and the better learning you are going to be able to do when you go to clinical and when you care for your patients. The more you apply yourselves in your classes, the more you are going to learn in clinical. Even though it's great and all to strive and try to achieve that A, this is going to lead me to my next topic, which is your grade does not define the type of person you are or the nurse that you are going to become. I know I'm one to talk because I'm literally the type of person that will get upset when I get a B on an exam. Once you get your degree and you're working, your patient cares more about the care that you provide to them. Nobody's ever gonna ask you about your grades that you got in college. Your patient's never gonna ask, did you get an A in med-surg? Did you get an A in pharmacology? Did you get an A in patho? Nobody's gonna ask that to you guys. In nursing school, you guys are gonna be learning a huge amount of information at a really quick rate. So yeah, your professors aren't gonna expect you to know all the material. They're not gonna expect you to get an A on every exam. But what they do expect is that you guys are putting in the work and you guys are putting in the effort to really learn the material and apply yourself to the clinical setting and to provide competent and safe care that's effective to your patients. That's what matters, guys, not the grade. Any nursing student that says that they breezed through nursing school and they did everything perfect, they never struggled, they hit every single IV, they passed every single med math test, don't lie about that med math test, okay? Because other nursing students watching this, I know everybody struggled with med math at one point, okay? Anybody that says that they breezed through nursing school and didn't fail at something or didn't struggle at something, that's a lie. My point is, we've all struggled at something in nursing school, whether it was lecture, whether it was clinical, whether it was simulation, whether it was a personal issue. Everyone struggles. It's all a part of the learning process. Nobody is going to get everything perfect on the first try. It's not about the grades. It is about you caring for your patient and really applying yourself and doing your best to learn what you need to know to be able to care for your patient in a safe and effective way. You could teach somebody how to get an A in pharmacology, but the one thing that you cannot teach somebody is how to care. And that leads me to my next topic. Take advantage of your clinical opportunities and do not be afraid to ask questions. Do not be afraid to ask questions. Clinicals are where we as nursing students get to finally apply what we've learned in lecture, from our labs, to our simulations, to the care of a real patient in a real hospital. You're going to be followed around by a nurse, a preceptor, a clinical instructor, whoever it may be, but they're going to be a nurse and they're going to be at your side to make sure that you're providing safe and competent care to your patients. If you have a question, make sure to ask that question. Chances are your preceptor or nurse, they've probably had that same exact question when they were a student too, because remember, not everybody is going to get it on their first try, and they're not going to expect you to know everything once you're at the clinical floor. This is where we're going to learn. In order to learn, you're going to need to ask those questions. You're going to need to get in there and attempt to do those procedures. If you guys see opportunities around the unit to do something cool or to see something cool, insert an IV, hang an IV bag, see a procedure being done, ask to be a part of that procedure, because I can't tell you how many times I missed out on so many opportunities because I didn't ask. Sometimes nurses are going to be really busy and they're not always going to have time to ask you as a nursing student to come along with them to help them insert an IV. If you guys notice that they might need some help, or you know that they're going to go hang an IV bag in a few minutes, guys, ask them, hey, can I come along with you? I could definitely help you do that. Can I come and watch that? Can you teach me how to do that? More than likely, the nurses on the floor are going to be very willing to help you and answer your questions and to have you help them out during whatever it is that they need to get done, because guys, they understand. They were students at 1.2. So guys, at clinical, always remember to ask questions if you have them, and don't be shy to ask to participate in those procedures. More opportunities is just another opportunity to learn. And another opportunity to learn is another opportunity to get better at your nursing skills, to increase your nursing knowledge, and that in turn is going to allow you to provide safer, effective, and more competent care to your patients in the future. Alright, this next thing that you should know is really going to back the fact that you need to ask questions when you have them, because I promise you, you will have them. This next thing that you should know is that nursing is really heavily focused on human anatomy and physiology. Now, depending on your program and depending on when you take human anatomy and physiology is really going to really help solidify and help you better understand more complex disease processes as you come to learn them. Human anatomy and physiology is not an easy class to learn. You guys will have to learn all of the bones in the body at some point. You will have to know what the different organs in the body do. You will have to know what the different cells in the body do. This is going to be second nature to you at some point. When you first step foot into the clinical, I promise you, you guys are going to see a whole bunch of different words and vocabularies never seen before, and you probably won't ever be able to pronounce correctly. Endoscopic endoscopola Colgate total. Endoscopic cholangiopancreatography. My point is, human anatomy and physiology is huge. Once you're in the hospital, medical terminology is like a whole new language, and you're gonna start to learn that really quick. Each different word in medical language is going to refer to something related to the body. It might be intimidating, but if you think about it, without A&P, we wouldn't be here. We wouldn't have our bodies. We wouldn't have hearts, kidneys, livers, and whatever other organs we need. Now, what I felt like really helped me out when I was learning human A&P was the fact that I took a CNA course prior to coming into nursing school. Now, what does CNA stand for? CNA stands for Certified Nursing Assistant. And what do? They do exactly as their name states. They assist the nurse. They can be found in care homes, assisted living facilities, medical centers, hospitals. Anywhere where there's a nurse, there's more than likely also going to be CNAs. In the CNA course, you're not only going to learn basic human anatomy, but you're also going to learn basic nursing skills that are really going to help you in nursing school, such as how to take vital signs properly, when should you call for help, how to properly ambulate a patient, how to feed a patient properly, how to properly bathe a patient. Not only is taking a CNA course going to benefit you in human A&P, but it's also going to benefit you in other nursing courses as well. The next thing that you should know is that you should take advantage of great opportunities that present themselves. If you have an opportunity to volunteer, if you have an opportunity to be a part of the Student Nurses Association, the student government, maybe apply for research, apply for an internship. If you guys have different opportunities like that, I definitely recommend that, you should go for them and try something new. Not only is taking advantage of different opportunities like these going to increase your skill set, but it's also going to expand your knowledge and outlook on the different things that you come across in life. It's also going to really benefit you when it comes time for you to apply for a job. Guys, employers love to see different experiences on resumes. Differentiating yourself from different applicants that are going to apply for the same job is really going to make a huge difference on whether or not you get a call back from that employer. So guys, I definitely recommend that you take advantage of great opportunities, because not only are you going to learn probably new things, you might learn that you like doing certain things, you also might learn that you might not like doing certain things as well. And that's okay, guys. It's all a learning process. But if you have different opportunities that present themselves, I definitely recommend that you take advantage of them. After talking about all that stuff, guys, it's going to be really important that you listen to this very essential next thing that you should know. You should definitely know that you need to be able to take the time for yourself. In nursing school, you're going to be really busy. You're going to be working really hard. You're going to need to take the time to relax. You're going to need to take the time to treat yourself. We can't care for patients in the hospitals if we don't care for ourselves. Oftentimes, we get so caught up in nursing school and get so caught up with our studying, our homework, our exams, our clinicals that, we forget to do some self-care. We forget to care for ourselves. And how can we expect to care for our patients to the best of our ability if we haven't even cared for ourselves? It is okay to take a break sometimes. It is okay to relax and breathe. And guys, it is okay to treat yourselves. And the last thing that you guys should know is that it's all worth it in the end. Guys, nursing school is a journey. It's hard work. It's long hours of work. It's a lot of studying. It's sweat, tears, and blood that's probably not even yours. And you know what? Nursing school is a grind. It's a journey. And in the end, you're gonna be really happy that you went through it all. So that's all I have for you guys today. This has been some of the things that I felt you should know before going to nursing school. So if you liked the video today, make sure to like, subscribe, comment down below any questions, suggestions, ideas for videos that you might have, and I'll make sure to also follow me on Instagram. Thank you for watching my video, and I'll catch you guys next time.